Why is an electrolyte panel important in stroke diagnosis? Imagine your brain as a finely tuned machine that relies on tiny electrical signals to keep everything running smoothly. These signals depend on minerals called electrolytes, like sodium, potassium, calcium, magnesium, and phosphate. When these minerals are out of balance, it can disrupt how your brain functions. That's why checking electrolyte levels is so crucial when diagnosing a stroke. In the moments after a stroke begins, the body's mineral balance can change quickly. For example, low sodium levels, known as hyponatremia, are common in stroke patients and are linked to worse outcomes. This imbalance can make brain swelling worse, increase the risk of complications, and even affect how well a patient recovers. Similarly, low potassium or hypokalemia can influence the severity of the stroke and delay the return of normal function. Calcium and magnesium also play key roles in nerve signaling and muscle activity, so their levels can impact neurological status and recovery. Measuring these electrolytes helps doctors understand what might be contributing to the stroke or worsening symptoms. For instance, dehydration or kidney issues can cause electrolyte disturbances, and identifying these problems allows for targeted treatment. Correcting imbalances can improve brain function, reduce complications, and support recovery. It also helps clinicians monitor the patient's condition during hospital stays, as electrolyte levels can fluctuate during treatment. Furthermore, electrolyte levels provide important prognostic clues. Certain abnormalities are associated with higher risks of death or poor recovery, helping doctors plan the best course of action. While blood tests for stroke also look at blood clotting factors and blood sugar to determine the type and severity of the stroke, the electrolyte panel specifically focuses on minerals vital for nerve and muscle health. In summary, an electrolyte panel is a key part of stroke diagnosis because it reveals mineral imbalances that can influence how severe the stroke is, how well a person recovers, and what treatments are needed. Recognizing and correcting these imbalances early can make a real difference in patient outcomes. Always remember, if you or someone else is experiencing stroke symptoms, seek immediate medical attention and trust healthcare professionals to guide diagnosis and treatment based on comprehensive testing.